Hello everyone and welcome to day 2 of week 1. Today we will be focusing on the remaining chapters. So we're going to finish up chapter 1. We're also going to discuss chapter 2 and chapter 56. So let's dive right in here. So if you remember, again from the week 1 video, we talked about how chapter 1 is more of an introduction into the healthcare field. We really discussed on day 1 how a medical assistant is a newer part of the medical world and how individuals become accredited and certified. So today I want to focus on what are the responsibilities of a medical assistant and what are good qualities to make a medical assistant. So the responsibilities of a medical assistant are very extensive. That's why the training and education that you receive here will be so intense, and it will provide a great deal of hands-on work. Always remember that you must perform duties that are within your scope of practice. Doing tasks that are beyond or outside of your scope of practice or what you've been trained to do could result in you harming a patient or even losing your certification. So when you go into the field, make sure that you're doing things that you know how to do. Now, when we talk about the responsibilities of a medical assistant, they fall into one of two categories. They are either administrative responsibilities or clinical responsibilities. And as you can see, the administrative responsibilities are more of the front desk or front end tasks. Things such as scheduling your patients, greeting them, checking them into the doctor's offices, reconciling bank statements. Maybe you're handling mail or doing billing or insurance claims. Maybe you're collecting co-payments and things like that. Where the clinical responsibilities are more of the back-end tasks. Things such as obtaining medical histories, performing lab testings, maybe assisting with some sort of procedure or exam with the physician. Making sure that you have your inventory in control and that you have all of the equipment that you need in order to really function well within the facility. So these are the responsibilities of a medical assistant, but there are other things that you need to take into consideration when you're becoming a medical assistant. And those are, what are the good qualities that you need? So a couple of the qualities that I think are really important for medical assistants to have are things such as integrity, which you want to be honest and truthful. You want to have empathy or have the ability to show compassion and understanding. Have discretion. Know what it means to make a sound judgment and make sure that you stay within a boundary. Have confidentiality. Keep your patient confidential information private. Don't go sharing it in a hallway or a crowded elevator. Don't talk about it in the lunchroom. It should stay private. Making sure you have thoroughness or be attentive. Show some pride in your work. Make sure that you can follow through on things. Be punctual. Have congeniality. Be able to get along with a diverse group of people and a diverse group of age ranges and different attitudes in the way that we work things. Be proactive. Take a stand sometimes. Do things without being told to do them. Know what your provider will need before he even says it or she even says it. Have competency. Keep up with the current skills that are coming into the field. Make sure that you're staying on top of your game. And you can do that a lot with those CEUs that you need, those continuing education units. So that's going to finish up chapter 1 for us. Let's move on to chapter 2. Now, chapter 2 is really discussing the history and influential individuals throughout the medical field, but it also is going to talk about the different types of medical practices you can work on, and it talks about the different allied health professionals and the way that they're termed. So one of the most important people that I feel that you need to know about in the field is Hippocrates. And Hippocrates is known as the father of medication. So he really stressed that the body's healing nature is helped to form, he helped be able to diagnose and describe what diseases are, and really help to discover the ability to identify those diseases by listening just to the chest only. Hippocrates is also credited with creating what the doctors use, that Hippocratic Oath, and they take that before they enter into the field. And what it is it's a guide or a pledge that really states that they will do no harm to patients, they will prescribe no deadly drugs, they will give no advice that could cause the patient to die. When we're talking about the different medical practices that medical assistants can work in, you can really work within any different specialty within the field, but it's really important to know that the most of the specialties do allow and have medical assistants working within them, as most of the job opportunities for medical assistants are in an outpatient setting, but that is rapidly changing, and we're seeing a shift where MAs are going more inpatient. But you could work in anything: cardiology, endocrinology, you could work in OB/GYN, you can work in allergy and asthma and ear, nose, and throat. You could really work in any sort of field that you wanted. So throughout your time here at Rasmussen, you will go through different stages where you learn different procedures and different tasks, and you'll be able to determine, maybe what your field of interest really is. But the last section of Chapter 2 that I really want to talk about is knowing the difference between individuals within your allied health professionals. So you need to understand the difference between certified, licensed, and registered. Certified means that this individual is being issued a certification or credentials by a professional organization because they have met the educational and experience standards of that organization. So for example, when you finish here at Rasmussen College, you will be able to sit for your CMA, or your Certified Medical Assistant exam. That is a certification given to you if you pass the test by the MA. Where a licensing, or being licensed, means that a government agency, usually a state agency, authorizes that the individual is able to work in a given occupation. So an example of that would be like a licensed practical nurse or an LPN. And lastly, a registration means that the professional organization in a specific healthcare field administered examinations and maintained a list of qualified individuals. So how I like to think about that is it's kind of like signing up to register to vote. You put your name on a list, you become registered on that list, and then you're able to vote. That's what an RMA is, or a registered medical assistant. They are not registered through the MA. In fact, they are registered through the AMT, the American Medical Technologists. So that kind of wraps up Chapter 2 for us. And our final chapter is Chapter 56. And this chapter is really dealing with patient education. As a medical assistant, one of the roles that you will be doing is passing information on to patients as ordered by the physicians. This could be things such as lifestyle changes and preparation for surgery or a procedure. Maybe it's disease-specific information or treatment plans. But with every patient education, it's really important to understand that you will need to alter this depending on the patient. It's not going to be a cut and dry, it's all the same. It will have to be, set up for each person. And patient education is set up in 5 different steps: the assessment, the plan, the implementation of the plan, documenting, and evaluation. So assessment is really the beginning stages, and it defines what your patient's needs are. The plan is where you determine how you will take that task and how you'll teach that patient. The implementation is really where it involves you teaching this patient how to specifically do what the provider has asked of them. Always document what you've done, and then evaluate the patient at the next visit to see how well that plan is working. Remember, a good teaching for a medical assistant can empower the patient to make positive life changes. So be a role model for your patients. Show them what they need to do so that way they can be better themselves. All right, that ends the Module 2 video for this week. If you have any questions or concerns, please bring them to day 2 and we will discuss them at that time. Thanks, everyone. Have a wonderful day. Bye-bye.